guys, and welcome to this week's episode of Dermatologist Talks Science of Beauty. I'm Dr. Teo Wan Lin, and today we're going to talk about various TikTok skincare hacks and how some of them may actually turn out to be dangerous for your skin.
Ooh, this is a topic I'm excited to get into because I've seen so many skincare or beauty hacks on TikTok or Instagram that people usually try from home, and some people really swear by. So I've always wondered whether or not they actually bring benefits to the skin. Well, first of all, let's talk about microneedling. Microneedling is a cosmetic procedure popular in many aesthetic clinics that involves pricking the skin with small needles. The theory is that these small wounds cause the skin to start its wound healing processes and produce more collagen and elastin to heal the skin. Well, there has been a rise of a worrying trend to do with at-home DIY microneedling. Well, is microneedling safe to do at home? What are your thoughts on that?
Well, microneedling, in my opinion, may be considered a little archaic. The reason why I say this is, while there are in-office microneedling treatments, these are certainly not state-of-the-art type of treatments that minimize tissue trauma while stimulating collagen production. Well, the key concept is that you are trying to introduce microperforations in your skin to increase the absorption of certain products. However, if you've ever had a microneedling procedure, you know that it can leave bruising, marks, and punctures in your skin, and it's also quite painful for the individual that's undergoing the treatment. My personal opinion as a dermatologist is that there are so many other treatments which are available that have a focused result. Like, for example, for acne scarring or other types of scarring, physical therapy, whether it's in the form of laser treatments, ablative or non-ablative lasers, these have specific cellular actions. And if you're just talking about superficial skin treatment at the level of the epidermis, there are chemical peels. All of these procedures can also increase product absorption. Microneedling on its own has been recommended as a cost-effective way, say in less developed countries as an alternative to CO2 laser treatments for acne scarring. But on its own, is not as effective unless you are pairing it with a cosmeceutical. So the other thing is both the cosmeceutical and the microneedling instrument in theory should be sterile because there are skin punctures involved. And it should also be performed by a medical professional. In that sense, I don't think there is a lot of evidence for microneedling as an aesthetic intervention. The ways of increasing cosmeceutical absorption that are non-invasive or in a sense that doesn't traumatize the skin would include the novel use of materials. So that's what our company, the Biomaterials Arm, does. So we use polymers that alter the skin microenvironment as well as functional textiles. The key concept to understand is that if anything damages your skin barrier, firstly, there's always going to be a chance of a side effect, specifically irritation. And there will be certain patient groups that, of course, we end up seeing who perhaps you would call unfortunate, who can get infections. So we're not just talking about typical skin infections. If you're using non-sterile, non-disposable equipment, especially at home, this can be dangerous.
So would washing the needle, for example, with antibacterial soap and tap water work? Why are these so dangerous?
The reason for this is because of a certain type of tap water bacteria that can occur even on perfectly clean instruments, so clean, not sterile. Beauticians, for example, often say, oh, it is brand new, but it is not something which has been autoclaved by, say, gamma rays, which is the standard in medical surgical procedures, you can certainly contract mycobacterial infections, cutaneous mycobacterial infections. I've seen these cases before. Microneedling, in theory, is considered of slightly lower risk, but it is still important for us to appreciate that non-sterile microneedling instruments are not exactly safe for use. I have, for example, seen patients with these mycobacterial infections that arose after facial extractions by beauticians. And these had to be treated with months of oral antibiotics.
Well, I'm familiar with blue and red light therapy in a clinic setting, but what about at-home LED light devices? Can they benefit the skin? Are they safe to use in a home setting?
I would love to share a little bit about these at-home LED devices. It is actually a very established sort of skincare trend. My main concern is really the devices that are available without eye protection. The efficacy of home devices is limited by the size of the device. The studies so far for LED lights exist only for in-clinic treatments with the ability to generate higher energies. For small handheld devices, I am not sure if it's even able to generate a fraction of what is required or what has been deemed to be effective based on these studies. Nevertheless, it is true that red light, for example, does stimulate your skin's mitochondria, which is the powerhouses, to produce more collagen and also to enhance the cell processes that enable cell renewal to occur more efficiently. What is relevant is for consumers to realize that Neutrogena, which is actually one of the most established brands in the world that work with dermatologists, they were amongst the first to launch light therapy masks. They actually recalled their masks due to concerns that there could be some level of retinal damage. Now, it is definitely a decision that they took, erring on the side of caution because of certain at-risk users, say, for example, those with photosensitivity conditions such as lupus, autoimmune diseases, for example. Nevertheless, it is sometimes difficult for us to predict when it might happen to an individual, especially if there is no light protection for the eye. So in the clinic, we always have these opaque black goggles, and the treatment is, of course, with a huge machine. Now, there are brands now that offer these light therapy masks with eye protection, and I think that would be the gold standard for home treatment because there is evidence, of course, that these lights in particular stimulate parts of your skin physiology that may be beneficial.
That makes sense because apart from the mask that you're putting on your skin, it's also covering your eyes, so we can't forget about eye protection since they're one part of the face that is so sensitive. Well, moving on, I've also heard of DIY scrubs such as coffee scrubs or putting baking soda on your face or even sugar lip scrubs. What is the science behind this and how does it work?
On the topic of, DIY sort of skincare, I think what I have come across myself is, sugar lip scrubs, for example, which I thought was kind of cool and quite fun. It's not a bad idea. Firstly, it's edible, so sugar is edible. The problem is I'm not totally, on the side of recommending scrubs in general. So sugar itself is considered a coarse granule that's going to be harsh on the lips. So the lips are part of your skin, but it's a very special part known as the mucosa that is far more sensitive than the rest of the skin on your face. The lip scrub that we compound in the pharmacy is from a phytoceramide formula. So if you're familiar with phytoceramides, they are ingredients derived from plant seed oils or the nuts. So the nuts, for example, when you extract it, you get a lot of these good fats. And these can repair the barrier, and it's also an edible formula. Above all, it is important to recognize that there is a need for some sort of physical exfoliation of the lips because, we often feel or we see this flaking on our lips, and when we remove it, it's easier to apply glosses and lip balms, etc. But we also should address the reason of the flaking. So it's commonly cheilitis, a condition which is synonymous with lip eczema. What happens is there is first a defect in the barrier function of the lips, and then the inflammation begins, leading to flaking. In the case of the phytoceramide lip scrub, it is using microcrystals which encapsulates the phytoceramides. So that when you rub it into the lips, it essentially disappears. It also has the additional cosmetic effect of removing the flakes and also is working as an emollient.
Yeah, same with the trend of putting various foods such as apple cider vinegar or turmeric face masks for the face. So on their own as a food, we know that these can bring various health benefits, but can it really help with our skin?
Using apple cider vinegar or turmeric mask is kind of interesting. If you were to do a literature search on these active ingredients, you find that there is scientific evidence that suggests that these are potent antioxidants. The key thing is that these active ingredients have to be extracted and formulated in a way that it is non-irritating, retains its potent cosmeceutical effects while functioning as a cosmeceutical. The issue here I want to remind our listeners is that you really should not make your own skincare. You don't boil it, cook it, or mix it up in your kitchen, simply because cosmeceutical formulations have to be firstly stable, and secondly, it has to be compatible with your skin. It has to be non-irritating. Furthermore, the concentrations that are present in food is so high that it's really more likely to cause irritation in individuals who do not have an allergy, but simply do not tolerate the pH of this ingredient. I think in terms of efficacy, when it is in the form of a food and you are applying it to your skin, I'm not sure if it's able to penetrate the skin.
Well, what about if it's in a powder form? Would that work better?
Well, I think the commonest example of a potent superfood or antioxidant that's available in a powder form is, say, turmeric. So if you're actually applying the turmeric powder on your face, on your facial skin, I don't think that this is a viable method of absorption. So powder formulations firstly absorb extremely poorly. The only application of powders would be, in the form of astringents to absorb excess moisture, say in hyperhidrosis, excessive sweating. The main side effect is dryness caused by the powder formulation itself. So the other thing is, if you're going to be using these DIY masks, you really have to bear in mind the concentration of the active ingredient and the actual formulation, whether or not it is cosmetically acceptable, practical, whether or not it is going to be accepted by your skin. So in the first place, if it can't be absorbed, you're really never going to see an effect. And absorption has to take place via the stratum corneum. The risks are also very real, as there is a high risk of irritant contact dermatitis, and there will be people who are actually allergic to turmeric powder itself. So in cosmeceutical formulations, these would be in the 0.01 or 0.1% range. And the bulk of it will actually be in something we call a vehicle that enables the product to be effectively absorbed by the skin barrier, which is the stratum corneum.
Well, a couple years back, and I think I've recently seen it circulating again, I saw beauty blogger Suki Man's Instagram post where she posted a tutorial on how to get rid of whiteheads and blackheads. Well, what she does is that she takes 2 flossing sticks and scrapes them down and around the nose. Then she soaks a cotton ball in mouthwash and then uses it as a toner. Is this a good DIY hack, or is it just plain dangerous?
Now, it's quite interesting. So this is the dental floss whitehead extraction that we see on TikTok. So I, first of all, don't recommend using any physical or traumatic methods to remove whiteheads. The closest effective sort of extraction tool that you can use at home is probably microdermabrasion. So for vacuum microdermabrasion, for example, it's not correct to use the vacuum to suck out blackheads, for example. And that's what's commonly marketed because in a sense it's very gratifying. What happens is, for blackheads or whiteheads, the debris, especially for blackheads, will reaccumulate. And I'm sure all of us who have had blackheads before see it come back. So the way to treat it is never about physical removal, but is to treat it at the microcomedonal level, using either retinoid with peels, or with laser treatments. Certain botanical extracts are also proven to control oil production, such as chlorella. That's an algae extract. The problem with extraction of, using any method is that it is going to traumatize the skin, and it can cause infection, and thereafter, if there is inflammation, you get scars.
Well, in the same vein of using dental products on our face, because this is what's popular right now, what about the age-old tip of using toothpaste on your zits? Some people swear by this hack.
Yes, I've seen toothpaste being recommended by these TikTok users as a pimple cream. The key thing about toothpaste is that it contains an astringent and is also a highly alkaline substance. So I don't recommend that on your skin. For sure, you will get skin irritation, irritant contact dermatitis. Drying out pimples is a very outdated way of treating pimples. The pathogenesis of acne is essentially, in a genetically predisposed individual that leads it to inflammation, which starts with microcomedones that actually appear on the surface of your skin after a process of say 2 to 3 weeks, and then we see blackheads or whiteheads. which are respectively open and closed comedones. So coupled by the growth of secondary skin bacteria, it can get infected. And when you see a lot of pus on your face, for example, that's not just acne alone. It's a secondary infection known as gram-negative folliculitis. The primary bacteria causing acne in inflammatory acne is P. acnes. Increasingly, we talk about C. acnes as the predominant pathogenic acne organism. When you treat acne, you really want to target all these factors for a holistic approach as well. Well, we know it is impossible to change one's genetics, but all acne treatments are targeted at, firstly, controlling inflammation, because that's going to stop the comedone formation process. Secondly, we need to address scarring. So toothpaste and, virtually just thinking of drying out the pimple does none of that. There is a role in an effective pimple cream, it plays to control seborrhea, which is what we call, in medical terms, referred as excess oil production. And physical methods, when applied to individuals with very oily skin, for example, when you apply zinc oxide, it can help to improve these seborrhea. Most individuals with mild or moderate acne, they will complain that their skin is both oily and dry. It's not a paradox, because the truth is most commonly they have oily skin, but all the topical treatments they are using, such as benzoyl peroxide, which in my practice, we've stopped using it for the last 5 years, is not very effective, and it can cause irritant contact dermatitis, which is the reason why you feel that superficially your skin is very, very dry. Instead, we use anti-inflammatory botanical agents, with Masni becoming a relevant issue these days, using a benzoyl peroxide containing acne cream, or even these DIY astringents like toothpaste, it will definitely make the problem worse because of the occlusive effect of the face mask. So if it's going to be drying on its own, when you wear a face mask in the daytime, these drying effects are amplified. So I've spoke about this in my white paper on Masni. It was published in the Journal of the American Academy of Dermatology in November last year. It's also available via the COVID-19 resources on PubMed. So in that paper, I have detailed recommendations for Masni, and it's also available in a previous podcast.
Well, in this episode, we've talked about various skincare trends such as DIY microneedling, homemade face mask, different sorts of pimple treatment at home, and how not only do some of these not confer benefits for the skin, but may even be harmful. Well, that's it for this week's episode. You can follow Dr. Teo on Instagram at Dr. Teo Wan Lin for more podcast updates, and do remember to check out our website at www.scienceofbeauty.net for the full podcast transcript.